Diabetes remission refers to the state where, through standardized treatment and lifestyle management, a patient's blood glucose levels and other related indicators return to pre-illness levels. That is, a state of complete remission. In this state, patients can reduce or discontinue their medication under the advice of a doctor. Generally, it refers to the remission of type 2 diabetes. In layman's terms, it means that without hypoglycemic medication, the patient's blood glucose can still be within the normal range. So, how is it defined as remission? In 2021, the American Diabetes Association (ADA) and the European Association for the Study of Diabetes (EAS) did jointly release the expert consensus on diabetes remission. The consensus proposed 6 core recommendations on the naming, diagnostic criteria, and diagnostic schemes for type 2 diabetes remission. The standard for remission of type 2 diabetes can be defined as after discontinuing hypoglycemic medication for at least 3 months. The glycated hemoglobin HbA1c is less than 6.5%. It should be noted that remission is conditional and not all patients with type 2 diabetes can achieve remission. The ABCD method can be used to assess the basic conditions for remission. The more conditions met, the greater chance of remission have. Antibody, negative glutamic acid decarboxylase antibody GADA, and other island-related antibodies indicate no immune response to the destruction of islet cells. BMI is greater than or equal to 25 kilograms per square meter, or waist circumference for men greater than 90 centimeters, women greater than 85 centimeters. C-peptide, C1, fasting C-peptide is greater than or equal to 1.1 ang per milliliter. Postprandial to H C-peptide is greater than or equal to 2.5 ang per milliliter, indicating that there is still a certain beta cell function, which is the basis for T to DM remission. C2. Complication assessment. D. Duration. Clinical evidence shows that T to DM patients with a disease course is less than or equal to 5 to 10 years have a higher chance of remission. Numerous clinical trials on diabetes remission have confirmed that through a certain period of strict lifestyle intervention, type 2 diabetes can be significantly relieved, reaching the standards for discontinuing medication. The adjustment process for type 2 diabetes remission usually takes 3 to 6 months. Through a series of intensified lifestyle interventions, exercise interventions, and other means, the state of sugar toxicity, lipid toxicity, chronic inflammation, and insulin resistance in the patient's body is improved, repairing the damaged pancreatic beta cells. Even without medication, blood glucose can still be controlled within a good range, successfully achieving remission. Shijian Health, diabetes rehabilitation leaders.